Good morning, everybody. Hi, Becky.
Good morning, Lisa.
How are you?
Great. How are you?
Doing pretty good. Thank you so
Good.
much for being with us today. We really appreciate it.
Absolutely.
So I am going to use our time expeditiously. I would like to introduce Becky Byrne today. She's with us to talk about health insurance. And just as in the way of a brief introduction, Becky is a native Montanan, and she went to school, finished college in Texas. She's been in the insurance and consulting industry, is this right? Since 1988. Wow.
Yeah, I know.
I know
I look young. It's terrible.
or wonderful.
Right.
And she's been at Payne West Insurance since 2000. You're a VP there, correct?
Yes.
Yep. And she supports the strategic needs of 100 employers. It's probably more than that now.
Yeah, I've lost count, but a good number throughout mostly Montana. Yes.
And she also works in employee benefits, and she and her family love to be outdoors, as most Montanans do. They hike and ski and travel and enjoy sports. So we're very happy to have her with us today, and we'll try and get a share screen up and get this show on the road.
Great. Thanks, Lisa. Let me know if you can see this.
Okay.
Can you see this, Lisa?
No.
Okay.
So I can put it up and share it, but then you're going to need to tell me when to advance it.
Actually, I think I've got it here. And how's that?
Beautiful.
Wonderful. Well, good morning, everyone. And you're very fortunate to have an instructor like Lisa. She's been a good friend of mine for a while. She's invested, she's valued. I hope you're enjoying her class. I certainly enjoy her as a leader in our community. She enjoys her role in teaching, and having dealt with lots of professors throughout my life, she has a great spirit and an investment in all of you. What I hope to go through today is the world of health insurance, which can be fairly complicated. My goal is to give you a baseline to work from. And in and of itself, when you work within an employer, you're going to be looking at your benefit package and evaluating what that means to you. And so it's important to understand the basics. And my hope is that today I can provide that for you. In addition, as you look to support others in roles that you conduct your life in, health insurance is always going to be a topic of conversation. Predominantly our country and the cost of health insurance and care has been in the headlines for years, and it continues to be problematic. You can see within the Biden administration today, many of the mandates that are forthcoming that are being added into as a federal law within health insurance plans, but more importantly, the states then also have regulatory processes, and the two at times often conflict. So it's complicated. I'm going to stick with the basics so you have a relative understanding of what it means to you and your families. And then in the end, you guys have my contact information always and through Lisa, but I'm happy to answer questions in that format after today's presentation. So I'm going to go ahead and just do a slideshow here, and we'll get started. Hopefully I will. There we go. Let's move to the next page. I have been in the insurance industry for many years, and often the insurance industry it's got a foreign title to it. It's a great career. I'm going to offer that to all of you to think about, largely because it has so many options that can be offered to all of you. You can work on the service side, direct with a client relationship, traveling, adding value, managing their benefit programs, and meeting incredible people along the way. But you also can be on the consulting side, which is my role. And that allows you to use all of your skill sets, including the analytics side, but more importantly, the relationship side. It's been a great career for me and my family, and it allows me to travel and be in places where I can do business wherever I so choose. So if you ever have questions about that side of the business, I'm, again, a resource for you, and I'm happy to just talk to you about what your thoughts are, what your career goals are, and just be a sounding board for you. Back to what is health insurance. By and large, we have a definition here. You can purchase it today via the health insurance exchange, which was federally mandated under the Affordable Care Act back in 2014. What that allows you to do is go out and buy individual health insurance for yourself and your family for a premium, and you get to pick the plan design, you get to pick the insurance carrier, and it's a fixed cost for up to 12 months. So it is going to insure you without any pre-existing condition exclusions or limitations, which is really important. So if I have a pre-existing condition of diabetes, once you purchase that plan, it fully covers those services that you need to treat that particular condition. That wasn't how it played out prior to the Affordable Care Act. So you can imagine how that impacted individuals and families' lives. You can choose, and we're going to talk about these, deductibles, co-pays, co-insurance, and out-of-pocket liability. All of those are terms that some of you may be very familiar with, but they're foreign to many. And still yet, when I work with groups and their employees, it becomes a conversation where we start. So what does that mean to you? What is your liability when you go in to use services? That means what financial commitment do you have? And how do you decide which health plan is for you? And more importantly, making sure that the provider network, that is your physicians, your hospitals, your outpatient surgery centers, which ones are in network in the plan that you choose. And that's a critical part based upon where you live. Types of health insurance. So I talked about the exchange. That's where you purchase individual coverage. The best place to secure health insurance is usually within an employer setting for several reasons. It's an employer-based plan, therefore, often, not always, but the benefits can be richer. And it doesn't always just mean health insurance, but it includes dental, vision, life insurance, disability, and we're going to talk about those, and of course, retirement planning. An employer-based insurance program, they choose the plans they offer to you, but they are discounted coverage for a large pool of the mostly healthy people. That means when we look at the population in Montana, 85% of the population uses less than $1,500 in medical expenses in a given year. So a lot of the pricing center around those in critical care or those who have existing conditions like diabetes. It can be an expensive process and medical necessity to treat and stay healthy with particular conditions. But by and large, most people are fairly healthy and utilize limited medical coverage. The costs of premiums in a group setting are split between you and the employer. What that means is you're going to pay less. So if my health insurance costs $500 a month, the employer typically, on average, pays 85% of that single premium for you. We're seeing more and more employers pay 50% or more for family coverage. Family coverage today can be anywhere between $1,500 to $2,500 a month. Yeah, it's a big number. So how do you afford that on your own? So the group health insurance environment allows you to get those premiums paid for on a big level individually. So most of that's paid for by the employer. And then for family coverage, to afford that, many employers have shifted and are funding more of that on your behalf. And we'll talk a little bit about when you have a cost sharing, when you're paying for some of that premium, what that looks like if you purchase it as an individual or under a group plan. Individual health insurance allows you to pick your plan. It covers either just yourself or your family. It's a choice. You get to make those choices on an annual basis, and you can change every year. It's paid for entirely by you. So there's no employer contribution. Premiums typically vary by age and gender. So and also zip code. So the premiums will vary based upon where you live and who you're insuring and their ages and gender. Generally, you're going to be offered fewer benefits than you do under an employer group health plan. Government-sponsored health insurance, by and large, we're speaking about Medicare and Medicaid. We're going to cover both those definitions. So if you look at a profile of all the things that are offered in the health insurance world, I always say you've got the individual in the middle, you've got group employer coverage on either side, and then you've got Medicare when you're 65 or older, and Medicaid is a government program for low-income families. And all of those are subsidized, the Medicare and the Medicaid, by the federal government. And we'll talk a little bit more about that. So usually requires a special condition at times, elderly, low income, children, veteran or active service member, Peace Corps volunteer. So veterans, as you know, are also covered under a federal program. You may not know that, excuse me. So you'll see, you'll always hear about Veterans Administration, medical facilities. Here in Missoula, we have one being built out by the airport, a new facility, and that medical facility is for specifically veterans who have served in our country, and their coverage is paid for through the federal government. I want to talk a little bit about the employer plan and individual plan in a deeper sense. This is going to give you really an idea of costs and how, what is the average cost based on your age or on your salary. And when there's an employer contribution, how that can save you money. So this is just an example of what I've talked about. On average, employer plans, the average single premium in Montana is $6,840. And this is for an average plan. So oftentimes they call those silver plans, and they define plans under the Affordable Care Act based on a metal. So it's either gold, silver, or bronze plan. So silver is really that middle of the road plan that I'm basing these numbers on. The average employee contribution under an employer plan is 25%. Or $1,740 annually. The important part is when you're paying that premium, and the difference between employer and an individual plan is when you pay that through your payroll deduction, it'll come out of your paycheck. It's done so on a pre-tax basis. And that can save you a significant amount of money versus when you're paying it as an individual direct out of your bank account. So you will save the taxes on that premium. They call it a Section 125 plan. We have so much lingo in our business, but it's really under the IRS code, Section 125, that allows employees to run their premiums pre-tax, their contributions. Under an individual plan, you can see the average silver premium for age 30. Remember, it's based on age and gender. And let's assume they look at your income as well. So if you're making $30,000 annual income a year, your premium will be $450 based on your age, gender, and where you live for that silver plan. Excuse me, $450 a month. What I note here is the federal government under the Affordable Care Act provides individuals based upon their income subsidy. So in this example, this individual who's age 30, earning $30,000 a year, would be able to have their premium subsidized by the federal government by $325 each month. So the balance would be your responsibility. Why this is because medical insurance has escalated annually on average 5% over the last 10 years. Currently, the trend, that means the amount of the cost for your office visit for a provider or surgery, escalating this year at an average of 6%. Which is much higher than your GDP and has been for multiple years. So in this context, what the Affordable Care Act has done is said, we're going to help subsidize the premiums so you can afford to have health insurance. Premiums reflect the cost of care. So often if you're making $30,000, imagine with rent, food, electricity, internet, car insurance, paying $450 a month would not be doable. So this tax credit makes that feasible for the member to have good health insurance. At age 40, when you make more money at $50,000, you can see that tax credit goes down. Your premium goes up because as you age, you have more medical needs. So that premium would go to $500 and the tax credit would go down to $150. And there are no pre-tax savings. So reviewing this makes sense, right? That under an employer plan, you're going to pay less. And typically you'll have, not always, but typically you'll have better health medical coverage. Down below gives you more examples. I title one section called the Affordable Care Act Marketplace. And basically that's what we call the exchange or the marketplace that allows individuals like yourself to go out every year right now to purchase a plan, change the plan you have, that which you've purchased as an individual. So you have that 30-year-old example, that 40-year-old example, and 50-year-old example. So the total cost under the ACA marketplace is $450, $500, or $700. So the government or employer cost, if you're on an employer-based plan, is less typically. So it's $350. 40-year-old is going to be $150 or $185 for a 50-year-old. Your cost, therefore, would be $100. So on the 30-year-old, if you are under an employer-paid plan, $350 for a 40-year-old, and then 50-year-old would be $515. So it just overall, excuse me, I read that wrong. I apologize. I'm trying to look at up at you guys and then look down at the chart. That's under the Affordable Care Act, pardon me. So your cost on the marketplace as a 30-year-old would be $100, 40-year-old would be $350, and 50, $515. Again, based on your salary and age. Employer, you can see your cost across the board for any member. Doesn't matter your age, because it's not age-based under a group employer plan, would be $145 pre-tax. So again, if your tax, easy math for me is 20%. If you take 20%, that's going to be about $28 that you don't pay out of that 145. So it's going to be much lower than across the board for a better plan typically. I'm going to go ahead and move forward and talk a little bit about our government sponsored plans. And this slide cuts some things off. So my circles are a little bit bigger, I'm realizing. But the Medicare eligibility, let me review that. And sometimes you can have dual eligibility under Medicare and Medicaid. But by and large, what I want you to know is, what is Medicare doing for our community and who does it support? What health insurance, what population does this health insurance plan support? And those are people 65 and older. And people of any age who have a kidney failure or long-term kidney disease, and then people who are currently disabled and cannot work. And so there's a specific definition of disability under the Medicare Social Security definition. And I'll give you a good example though. A family member of mine who was less than 65 became disabled at the age of 60, and they had had a serious cancer. And in the end, what that allowed this member to do is be eligible for Medicare before 65. So by being eligible for Medicare, they no longer had to keep a group health insurance plan, if that makes sense. So they were covered by Medicare, which is a much lower cost and subsidized by the federal government. So Medicare in and of itself, there's two parts, part one and part two. And part one is paid for fully. Part two, the employee or that member, I should say, that family member will have a contribution each month, but it's much lower than what they would pay under an employer plan or individual plan in the marketplace. So Medicare is there. It was designed for when most people retired. Obviously, today people work well beyond 65, which is a choice, or they can retire at 65 and continue to have good coverage that is subsidized by the federal government. Medicaid is really, we've talked about this, it supports low income. So again, in Montana, we have several low income environments simply because of our wages. Sometimes, maybe not so much today, but we've had limited industries, and we just have lower incomes typically in Montana comparative to areas like Seattle, LA, New York. That makes sense. But pregnant women, children under a certain age, people who are 65 or older, people who are disabled, and people who need nursing home care. So Medicaid typically looks at low income. And again, I have individual came into my office. We talked about options. We looked at Medicaid and they met the definition of low income. So I simply helped them find where they apply for that, and they were able to be approved for Medicaid basically through the federal government, which is really important and again provides good care both for the individual and the family. Premium, the amount of money charged by an insurance company. So this is just, when you talk about premium, there's an amount of value for the plan you're purchasing, and that's the amount charged by an insurance company. So you've heard of Blue Cross Blue Shield, Cigna, United Healthcare, Aetna, and in Montana, you'll hear companies like Pacific Source, Mountain Health Co-op. But by and large, it's the premium is what you'll pay to that insurance company to pay for the health insurance that they're going to provide for you during the year that you have secured that coverage. Employers determine how much of the premium employees must pay for coverage, and it's usually pre-tax, as we talked about. So again, down below, that just gives you an example of how pre-tax works. You have your gross pay. So if you're getting $2,500 a month before that premium for health insurance is taxed, they'll be taken out your gross pay. So if it's $2,500 and the premium's $100 that you're paying for insurance, then under an employer plan, then your adjusted pay would be $2,400. They would tax that amount of money, and then you have your take-home pay. And that's all done internally through the employer. So there's no action you have to take. So as we get into the health plan and all, how they work, the first definition that's really important to understand is a deductible. By and large, that's the amount you'll pay before the health plan begins to pay for your bills, if you will. So if you go in for, let's say, surgery, both a doctor's going to be involved, usually some type of radiology and a surgeon and hospital services. Those bills all go into your health insurance carrier, and they're going to process those against your deductible first and foremost. That's your responsibility that you have to pay out of pocket. So in this example, John has a health plan with a $1,000 annual deductible. Annual deductible means it starts over every year. So if your plan year is 1/1 through 12/31, each January, you will be a new $1,000 deductible will apply. John falls off his roof and has to have physical therapy. That amount totals $800. And because he hasn't paid anything towards the deductible, those PT services you can see below, John will pay that full $800 out of his pocket. So when you in a group employer plan, you'll have the option to have the ability to set money aside pre-tax in what they call a medical savings account, which could help fund that. And so just be aware of that. So you want to ask your employer if they have a Section 125 plan that you can put money in a medical savings account. So he doesn't meet the deductible, so that's fully his exposure. He pays 100% of that particular issue. Co-payment, that really is saying, once I've hit my deductible, on the front end, sometimes health insurance plans say, well, we're not going to have you pay that first $1,000. We're going to actually have you pay a copay for a doctor office visit, urgent care, or seeing a specialty provider like a neurologist. So copayment or copay is what you're going to hear often is a fixed amount you pay for a very specific healthcare service. So below this example says Sally takes her son to the pediatrician for a bad cough. She pays $15 for that doctor office visit. Down below, you're going to see the cost of that visit is $200. She'll pay $15. The doctor sends in that bill, and the health plan will reimburse the provider $185. Now that doctor may have Sally pay that $15 right when she comes to the doctor office. And most usually that's what's transpiring. But the nice part of this is the health plan's picking up the majority of that cost. And that's called a copay or a copayment. Now we're going to get a little confused here. Right now we've got coinsurance. What does that mean? It's different than a copay. Copay's up front with a lower liability to the member responsibility. So they pay a smaller amount of a bill and health insurance picks up the balance. So coinsurance is your share of the cost of a covered health service as a percent of what was allowed for that. So if a doctor bills $1,000 for a service, Because they perhaps are a provider that Blue Cross has a contract with, if that's your health insurance carrier, for example, if they bill $1,000 for a service, Blue Cross has developed a contract that says, you know what, we're going to discount that by 20%. So really, that 20% isn't your responsibility, and the bill becomes $800. So that's what they mean by you're going to be paying a percent of what's been allowed. Allowed is what Blue Cross is going to allow the bill to be, and that's $800. So let me walk you through this example. I think this will help. John has to have knee surgery in the same plan year that he had the PT. And that surgery will cost $3,200. So because he's already paid the $800 toward his $1,000 annual deductible, you'll see that down below, John will be responsible for $200 of the $3,200. He'll be responsible 100% of that $200. So now he's met the $1,000 deductible. Okay. He has a coinsurance where the health plan will pick up 80% and he'll pick up 20%. So they're going to share in the cost up to a maximum amount. So in this situation down below, for the rest of the bill, which is $3,000, he's going to pay 20% of that, which is $600, and the health plan will pay $2,400. That's what coinsurance is. It's after you've met your deductible, and you'll be cost sharing in the next amount of costs up to a maximum liability. Your maximum liability is what we call an out-of-pocket maximum. That means in a given 12-month period, this is the maximum you'll pay, excluding the premium. So it protects you from, a major medical event. After you reach the annual out-of-pocket maximum, your health insurance will begin to pay 100% of your future expenses for that given year. Remember, they'll start over every year, but during that plan year. Some plans don't count all of your out-of-pocket examples. So a good example of that is if you have $1,000 deductible and your out-of-pocket's $3,000, some health plans will say, well, you owe the $3,000 and the $1,000 on top of that. I don't like to write health insurance plans that way. I think once you say total out of pocket, it should mean total out of pocket. So down below, you're going to see an example of you pay for a certain plan up to $3,000 deductible. So if you have a $3,000 deductible, that's 100% your responsibility. All your expenses are going to run towards that $3,000 deductible. Deductible is your responsibility. After that 80-20 coinsurance kicks in. So then if your out-of-pocket maximum on this plan is $6,850, the plan will pick up 80% and you'll pay 20% up to when you've reached $6,850. And so in a lot of health plans, most health plans, that deductible is included in that out-of-pocket maximum. What that means is you don't pay the deductible on top of $6,850. What you have to be really careful as a consumer to make sure the deductible does accumulate towards your maximum out of pocket. It's tricky in this business, and that's why a good consultant, a good advisor, somebody in the health insurance world can help you make that decision. Those kind of surprises are not fun to have when you have a major medical event that's unexpected. So yes, Lisa, thanks.
So when you go on the exchange, there's going to be, depending upon what state you're in, there's going to be different carriers. So right. Is it possible, I know Montana has a very limited number of carriers, but would it be possible, say in California, that I go on an exchange and I'm not comparing apples to apples because of this?
Absolutely. In so many ways, this business creates massive confusion because carriers want to secure more business. So what they'll do is they'll create plan designs that lower your premium. But if you have a major medical expense, to Lisa's point, that deductible could be on top of $6,850. So it's imperative that you get good advice, you ask all the right questions. And if you don't understand it, just look for somebody that works for a reputable insurance agency and they can help you. Okay, sorry. Oftentimes your parents are good help too.
So follow-up question there. So I'm a recent graduate. I'm possibly starting my own business, or I'm in between school and work, whatever. I'm trying to go on the exchange, figure this out for myself. Who would a consultant be that would help me? Because how would they stand to earn a commission if I'm trying to do this on my own?
Sure. You know what? The premiums that are on the exchange don't change if you use a basically an insurance agent. And because already built into those premiums is a fixed cost expense that gets paid to an advisor or an insurance agent. So it really pays for you to engage somebody to help you make these decisions and not have surprises. And usually it's a conversation that they're going to ask you questions about your medical utilization, your health conditions, and can answer what's best for you based on your income, your family needs, or your individual needs. So when you are in Missoula, for example, I work for Payne West Insurance, and you can call an insurance agency. Another one would be Glidewell Insurance Agency. There's several good insurance agencies throughout Montana, and they have a specialist who only deals with individual coverage. And I highly recommend using someone.
Thanks.
Bet. Preventive care, again, some positive outcomes that transpired back in 2014, which happened at the federal level, called the Affordable Care Act, said, under every health insurance plan, you must pay for preventive care at 100%. Now, that wasn't true before 2014. It makes sense, doesn't it? So if I'm going in and I'm getting my annual exam, or for females, mammograms, or I'm getting my blood work, biometric blood work done to ensure I'm healthy, to catch things early on, then the plan pays 100%. So in this example, Mary had a physical, right? And she had a mammogram, and you can see both of those costs, and those aren't unusual for those particular services. So the total cost is $400, but the health plan picks up 100% of that. Those are only paid for once a year. Now, if Mary goes into a preventive exam and they find something like, there's an outcome that they see something suspect in her blood work, she has high blood pressure. The physical exam is still going to be covered, but they'll be bringing her back in probably to either determine if there's a family history of high blood pressure, and usually to consider some form of medication to lower her high blood pressure, and possibly advisement on obviously overall health, health coaching, in terms of eating, diet, nutrition, et cetera, and activities. So preventive care, there's a breadth and depth of preventive care services, even smoking cessation, tobacco cessation programs, and counseling are paid under the preventive care benefits. So if you're curious and you don't know what those are, you can Google them. But more importantly, if you have a health insurance carrier, I would call them and just say, hey, I want to get this done. How is this covered? Do that before you go and have services. I hate surprises when my clients call me and say, I didn't know it wasn't covered this way. But you can always call your advisor, and you can call the health insurance carrier that you have secured health insurance through. Prescription drugs, probably the highest expense that compared to the GDP, and the annual trend or inflation cost this year was 14% on pharmacy. So it speaks to that particular industry and its profit margins. But it also speaks to, our rapid environment of research and drugs that are new to the marketplace that can treat conditions. And let me just give you an example why that trend is so high. There is a genetic drug that's been in research for over 10 years that basically treats genetic disorders and can cure them. Those particular drugs run 1.5 million in a given year. Some of those treat genetic conditions, so that cost will apply every year in a health plan. Imagine that expense. You're paying $500 a month, but the health plan's picking up 1.5 million behind the scenes. So that's why prescription drugs have escalated quickly, not only that, but candidly, that entire industry is has high profit margins. So we watch that. We work on the back end under group employer plans to control those expenses. So what we call a traditional plan was one like we talked about earlier. It has that $1,000 deductible. It has upfront coverage for office visits, sometimes where it pays that $15 copay. It has upfront copays for prescription drugs. So if I'm paying that my particular injectable drug for, let's say, MS costs $5,000 a month, under a traditional plan, you may only pay $50 a month for that. The health plan picks up the rest of the cost. So traditional health plans, and I'll counter what a non-traditional plan is here in a minute, has usually a 3 to 6 level tier copay based on whether it's a generic drug, which are lower cost drugs. They're not new to the marketplace. They've been in the marketplace for extended period of time. And there are now generic versions that are much lower cost. So there's different ways, but you'll typically see copays for those on the front end. Some of your more expensive drug, like specialty drugs, are what you call injectable prescriptions, and those are going to cost you more with a copay. Remember, on traditional plans, those pharmacy copays should accumulate towards your out-of-pocket. Again, a good reason to talk to an advisor to make sure those are accumulating towards your out-of-pocket. High deductible health plan. The difference between a traditional plan and high deductible is essentially your deductible is going to be something like $5,000. And what that means is all of your medical expenses will run towards that high deductible. You're going to be responsible for that. Now, why would you do that, right? The high deductible health plan allows you to, if your premium's $500 a month, by going to a high deductible, your premium may go down to $350. So the variable between those two saves you money. If you don't have a lot of health risks and you intend to put some of that money or all of that difference away into a health savings account, which I'll talk to here in a minute, that allows you to accumulate dollars in an account that you have that allows you to put money in there with a pre-tax basis when you're with an employer. So essentially, rather paying all that premium to the carrier, you will take some of that and put it aside in a health savings account. You can put more than that in, up to, this year, it's up to $7,100 in a given year. Why people choose high deductibles is because they may not typically use their health plan as much as someone else does. The other is it's more affordable. And affordability is a big issue with medical coverage today. So people take a little bit, obviously, more risk, but my advisement is you always want to take some of that money and take it out pre-tax on a monthly basis through your employer's payroll deduction. Have that be deposited into a personal account that you keep that follows with you wherever you go. So let me give you an example. My family's on a high deductible health plan. When we started with that, I couldn't put $7,000 in a year, right? So we would look at our income and say, here's how much we can put aside every year. And we also looked at what our medical expenses we anticipated that would be. Today, because we've been doing that for 10 years, we have 100% coverage. So let me tell you what that means. If our deductible is $5,000, our health plan pays 100% once I've hit $5,000. Remember, that $5,000 liability is my liability. So drugs, MRIs, any medical condition, treatment, surgery, all runs towards that $5,000. Once I hit that $5,000, the health plan picks up 100%. So we've saved in that health savings account, not every year because we've had surgeries, but we now have $15,000 in that health savings account. And that's all been pre-tax. It earns interest tax-free. And when I use the money to pay for any of those expenses, it comes out tax-free. I call it one of the best federal loans that you can take because it's your own money, but the government's allowing you to take it tax-free, put it away tax-free, earn interest tax-free, and use it tax-free. So be mindful when you're looking at plans, how that can benefit you or not benefit you. Under these plans for prescription drugs, all of your prescription drugs, except for preventive generic drugs, will run towards that maximum liability, which is $5,000 in the example I've given you. Whereas on the traditional plan, prescriptions would pay with a copay up front, just like office visits. So you can buy more coverage, you're going to pay more premium, or if you know you're not a high utilizer, or let's say you have a high prescription drug every month, it's 5,000. Sometimes that high deductible health plan is going to be better because once you've hit 5,000, it picks up 100% of your prescription drug coverage. And if the premium differential, you put it into a health savings account instead, could end up being a better financial environment for you. So it's a lot to learn, but again, an advisor will do that analysis for you. For the topic of prescription drugs, though, just be aware you have choices. So you might get a prescription from a physician. Always ask, is there a generic equivalent available? Because typically those are going to be paid if they're preventive at 100% on either plan. So you can see some of the price tags on in the example down below through 2020. You know, that specialty drug example from 2012 to 2020. Can you see the escalation? It's scary. But there's a lot of generic preventive drugs in the marketplace that 80% of people can use. So just make sure you're a good consumer and ask for that. Just a little bit, typically in a classroom, we'd have this discussion. So I'm just going to give you these to think about. And if I incur a $35 office visit copay, does this expense accumulate to my deductible or my out-of-pocket or both? And in the example I gave you, that $35 office visit copay would accumulate both, not to your deductible, but to your out-of-pocket. So keep that in mind. Those copays, again, a complicated health insurance plan design will accumulate towards your maximum liability, not towards your deductible. And the theory is you're going to get you're only going to have to pay $35 up front. So things that accumulate towards your deductible are going to be like your radiology, your surgical services. You know, remember your doctor office visits typically are a copay. So those will accumulate towards your out-of-pocket though. If you see an out-of-network provider, you're going to look at your health plans and recognize, and I haven't covered this yet, so let me just digress a minute. There is a network of providers with any health insurance company that you're purchasing health insurance for. So you want to make sure your provider's in network. And that's, again, what an advisor can help you look up. But you can also look it up on the website for Blue Cross Blue Shield, Aetna, Pacific Source, whoever your carrier is. But if you go to a provider out of network, you don't check it out before you go, often the provider will look it up for you before your appointment to make sure that your health plan is going to cover that service. But it's really your responsibility. Always call customer service before an appointment to validate that Dr. Smith is covered in network. But if it's not, that particular expense will not accumulate towards your in-network out-of-pocket. Often health plans have a separate additional liability for any out-of-network services. So just be aware of that. You're not going to see that issue arise often, but when it does, it's usually like an unforeseen experience. You're in, Timbuktu, Arizona, and the provider isn't in that network and you're sick. Mm-hmm. There's some of those things you can't avoid. So, but just be aware that if you have the ability to research it, please do, because that can be an additional expense for you. Do prescription drug copays accumulate toward my deductible and out-of-pocket? And again, we covered that. It does accumulate towards your out-of-pocket, but not your deductible. Now, under a high deductible health plan, your out-of-pocket and your deductible could be one and the same. The health insurance I have, it's one and the same, because it's just a $5,000 deductible, $5,000 out-of-pocket. Everything accumulates towards that maximum liability. Once we hit that, the plan pays 100%. My mammogram indicated a need for a follow-up screening due to a potential disease state. How would my second mammogram be covered? And of course, just based on our conversation, probably logic leads to it's going to become a non-preventive service. So that follow-up mammogram has a diagnostic code that is not preventive, and that would run towards your deductible and be your cost. Preventive services are paid at 100%. All right, some of us sit down and look at this and go, these are big numbers. This is premium I have to pay. How can I afford this, right? So that's really why the Affordable Care Act came to be, is to help you afford that through securing credits from the federal government. But if you're with an employer and you're paying $100 a month, I do see people opt out of that. They just, I'm healthy. I'm not going to need coverage. And they're just going to take that gamble. The downside of that is, and I've had a young person in my office, it's been about 4 years ago, that had, playing soccer, right? And had to have an ankle surgery done. It's $20,000 and this individual is uninsured. So, dealing with that was very difficult. They were put on a payment plan with the hospital with high interest. And thankfully we got that person onto a health insurance plan, at the open enrollment period during the fall. If you choose not to be on a medical plan mid-year and you have an event, you can't elect to get on insurance mid-year. There's only one period for open enrollment. And usually most often it's in November, December for a 1/1 effective date. So be mindful of that choice. Okay. I would never recommend that you not go uninsured if it's at all possible. And that's the Affordable Care Act gives you that option too. In this estimate, Milliman is a large analytics company. They basically have a lot of data around health insurance and the uninsured population, but someone uninsured under 65, let's just say that their healthcare bills exceeding, $13,300, it just becomes extremely expensive in these examples where now, again, the gentleman I had, if that person had to pay 20% of that, and they're under age 65, where does that income come from? And if it's an unpaid bill, I've seen hospitals take people to court. So again, I don't want to create an environment of fear, but I want to create an environment of making sure that you guys think long and hard about the choice of being uninsured. Now, 5% of those who are uninsured, they incur on average $47,300 a year. So is that a lot? I mean, you got 95% of the uninsured not incurring a significant amount of money, but if you happen to be that individual, then it could be significant. Montana's average inpatient cost per day, and you guys, these vary based on what your services you're getting. So I'm just doing really round numbers. State and local government hospitals could be 2,000, not-for-profit, 2,500. St. Pat's is a good example. Patrick's is a not-for-profit. And then for-profit hospitals tend to run a little bit higher, not always. And it depends on, what we've negotiated up front, but these are escalating. I would tell you a normal delivery for just a new birth is going to run at least, somewhere between $12,000 to $16,000. So again, it just expresses the need to have some form of medical care in place. Remember, there's Medicaid for those of us under 65. There is the affordable, there's the marketplace or exchange, and then there's employer health insurance. I always look for ways to save, whether you're insured or not. And so here's some just helpful, I hope, ways to save money. Pick the right policy, right? Be careful, get an advisor. And often people will buy a plan based on what their neighbor tells them to do, and that's not really the best methodology. So you can talk to an advisor and they're going to help you do that analysis in partnership with you. Shop for medication. So GoodRx is one of many discount services where you can go out and it'll list your cash prices by location for certain prescriptions, and they'll give you a coupon. So I'm going to give an example. One of my relatives, disabled, had a $700 a month drug cost, and he was not approved by Social Security yet. So basically I went out to GoodRx, found the drug, got a coupon. his out-of-pocket dropped from $700 down to $180. So just look at GoodRx. It can help you whether you have insurance or not. And it's a good way to get discounts on your pharmacy needs. Call carrier customer service. Ask questions before you get care. I've already beat that drum. Ask whether if tests are necessary. So an employer, a doctor, you have to be a really good advocate for yourself. They could order 5 tests for something that you may not need. So you can always hit pause. You can always do the research yourself, but you can always ask your physician if the necessity of certain tests. Ask for costs up front. So if you're going in for a service, make sure you understand what the cost is. And hospitals can be vague. Providers tend to be better, but make sure you understand what the cost is and how your health plan covers it or doesn't. Again, that eliminates financial surprises. And I always say, pick the right place for care. How do you know that, right? Well, you can look up and look at health grades and how doctors are rated and how hospitals are rated. And also find a place that if you have a specialty need, perhaps it isn't going to be best served here in Missoula. You can also call your health insurance carrier. They have what they call really centers of excellence. So if you have, let's say, for example, a musculoskeletal issue, there are centers of excellence that actually are going to cost lower, and they're going to provide you the best providers who are experts in that area. Tough one is reviewing bills and explanation of benefits. And I'm going to show you an explanation of benefit. Very difficult to understand billing, how it's covered. And again, your advisor can be of great service to you. So can some of those provider front office managers. They can sit down and go through that with you, but you want to be able to understand and read those. Keep copies of your test results and records. My mom taught me a great example of that. My father had a lung cancer early on in life, and we were going into surgery and they had the wrong lung marked. She had his health records. She was reviewing it before he went into surgery. Scary, right? It doesn't happen that often, but if you're not your own advocate, you're not looking at those results and records, you could get misspelled. You could be given the wrong medication. Don't want to make you afraid. I want to make you a good advocate for your own medical care, okay? Use county health departments and free screenings. Here in Missoula, Partnership Health is phenomenal. So in Missoula County, free immunizations, free screenings. So take advantage of what's available here in your local communities. You can negotiate big bills. I'm going to give you a great example. I ended up in the pediatric ICU at Community Medical Center with my son. He was probably 3rd or 4th grade, I want to say. And long and the short of it, he had been cleaning out a chicken coop with his grandfather unmasked. And he had a respiratory reaction. And it steadily got worse throughout the week. So I brought him in. They did an oxygen test on him and immediately sent him to the hospital. So he was treated by a pediatric ICU specialist who was not, they call them a locum tenens. They've traveled here once a month to provide services. They were out of network. How was I to know that? I was in a pediatric urgent situation. I had no choice. Long and the short is they wanted me to pay. It's about $1,000 out of pocket. And I just refused to. I was negotiating with them. So I just kept not paying the bill, which could be a problem, but I just said, I am willing to pay X amount for the service. And in the end, I got that bill down to $400. So I just waited 6 months and finally they need the cash. Hospitals don't like having account receivable. So again, when you don't know and you have no way of knowing that this is an out-of-network situation, always ask up front. But again, in that situation, I was surprised. Negotiate. It's your money. Telemedicine. Telehealth is big right now and I love it. So I can, and you guys probably know this, but I can call a doctor right now. And sometimes you might have to wait 30 minutes, an hour for virtually everything. I did my preventive care service this year because I wasn't required to do, some of the annual tests this year. I've had kids, my kids have been sick. So essentially we've done it over telemedicine and was able to get a prescription filled without going into the doctor. Time saver, low cost, high value. So telemedicine works really well. And then preventive care. That's, if you guys go in every year for your annual exam. Doesn't sound fun, but it's really easy to do. I tell you time and time again, especially you young folks, I have found several young people who have had things they found and were able to take care of, and just grateful that they got in for their preventive care services. So make the time. It's paid at 100%, and make sure you guys take care of your health. It's everything. Okay, explanation of benefits. It's called an EOB. It's what, in the marketplace. Here is a really complicated visual, but let me walk you through it. This is what you get once you've gone into the doctor, they've sent their bill in, the claim has been processed. And so it tells you, how did my medical plan pay for this? What's my liability? What was billed? What were the deductions? What were the discounts? And what do I have to pay the provider? So this subscriber, it'll tell you your member ID. So you always have your own member. This is an employer plan because it says group insurance. So on my right, but you're right when you're looking at it, a total of all your claims, you'll see the amount billed, which is $7,850. Discounts, reductions in payments. That's how a provider network contract works. So it says, okay, we got billed $7,850, but we're taking a good amount of that off. So the contract says you're not going to be responsible for $6,149. Sorry, that's small print, y'all. I don't know if I can increase that, but you may have to pay your provider the $1,701 amount. So go down below, and this is some of the service detail. So the plan provisions we'll talk about your responsibility. The amount billed shows for surgical charges, recovery room, medical and surgical supplies. You must have had surgery. And then lab. So those are any lab work they had to do for blood, etc. You had an MRI. It's a radiology service. And what pharmacy did they use, and any other items would be listed below. So you can see all the amount that was billed by the provider. Then they applied the discounts that the contract with Blue Cross, for example, applied. They have a contract with that hospital to discount that cost. So the amount covered is listed there. So under the surgical charges at $4,000, you apply the discount. I think that amount says $2,200, and all the way down, and what that total amount, the claim totals come to. So next it says, okay, so we're going to take a deductible of $1,000. Okay. And you're going to owe that. And then the additional amount is going to be cost shared. You're going to pay 20%, and the health plan pays 80%. So in this example, you have to pay the $1,000 plus the $240. Once you've met that deductible for surgical charges, everything else falls to coinsurance. Does that make sense? I can't hear you. I wish we were in person, guys. Sorry. This is hard to explain. But in the end, deductible and copay amount, you can see the total charges, right? So your deductible and copay amount is $1,055. Your coinsurance ends up being a little over, looks like $500. And then you have amount not covered. So there was something in there that was not covered. And typically I would negotiate that, y'all, just because I would. They shouldn't have provided it, because typically most medical plans should be covering that, okay? So this tells you how much am I gonna have to pay the provider. And if you have questions about that, you can call the provider's office. And then basically it'll summarize everything at the bottom, what was covered. You may have to pay your provider $1,701. I read these because I have found often mistakes in this process. And so it's important for you to look at that bill when you get it from the provider, look at the explanation of benefit, and do the math. If something seems off, call the provider and try to figure out if there was a mistake in the billing. Okay, that's the first place to start. And then you can call your health insurance carrier and figure out, did they process it wrong? Why wasn't this covered? And I always just think you negotiate things because often you'll get something off the price. So that's an explanation of benefits. And that'll always be sent to you when you have a medical expense that's sent in to the health insurance carrier. Often now they're putting them online rather than mailing them, but you can go and look at them anytime. Quickly, I just want to show you plan types. So we've talked about the traditional or high deductible health plan. You're going to hear about different networks when you buy something. The PPO is a preferred provider organization. That's your broadest network of providers. And a health maintenance organization is your smaller network. Deeper discounts, we don't have an HMO in Montana, but you will in California and in New York and some of those bigger states. So pay attention to that. If you can work with a provider group, smaller provider group, you're going to save more money and pay less out of pocket. So there's just different plans. So the only thing I want to point out here is this is how we analyze and look at plans. So down below midway, you'll see in-network, and you're going to see what a deductible is. Family deductible is usually 2 times individual. So for a family, you're going to pay $12,000 out of pocket under this example in a given year. These are high deductible health plans on the left. And then all of these actually are high deductible. So you can see how really in a quick summary, how benefits apply. So on the left, you can look at the deductible. Co-insurance is 100% once you hit 6,000. You can see what is not covered, with a copay. So you can see the deductible applies on this high deductible health plan for everything. And then prescription drugs also applies to that high deductible, except for preventive care and preventive prescription drugs. Those are all paid at 100%. And often that's all you need when you're younger and healthy, okay? So save the money and put it in a health savings account if you can. So I just wanted to give you guys a quick example of what that looks like. This is another example of an employer dual option. And again, this is just a quick spreadsheet that shows a traditional plan on the left and then a high deductible health plan on the right. And you'll see the differences. Something that's important down here, you can see in the yellow on the right, see your telemedicine. So on a high deductible, you can pay upfront with a copay, and that's only allowed. The IRS says you can't do that on high deductible health plans and have it be a qualified health savings account plan. But it says for telemedicine, you can. So you pay $44 for a telemedicine visit, which is very low cost. So that allows you to go to the doctor when you're sick for $44, okay? And oftentimes you'll get that prescription. Often that prescription should be preventive or generic. And if not, then remember on high deductible, you have to pay those things out of pocket. So you always want to shop for those. But the traditional plan has that $1,000 deductible. You'll see that in a third of the way down. It has your co-insurance. In this example, it's 70/30. Health plan pays 70, you pay 30 once you've met that deductible for expenses over the $1,000 until you've hit 3,000 out of pocket. And then down below, it shows you all your copays for whether it's office visits or prescription drugs. So that's just a quick, visual of what those health plan designs look like. I want to see something real quick. I want to show you some family premium trends, and then we're going to wrap up. So bear with me. I want to just go into something real quick here. Open it up. Okay. I think I have it here. I want to show you guys. I'm going to increase this so we can see it. This just shares a little bit about the escalation of health insurance. So let's see if I can resume share there. Oops, I don't know if this is going to allow me.
You should be able to minimize your PowerPoint, and then I assume you're going into a website, right?
Yeah, just bringing up an article. So how about if I do new share? Let's try that. That might work better. There we go. How's that? Can you see it?
Yep.
All right. Thanks, Lisa. And thanks for your patience, everyone. This just gives you a feel for the inflation side of medical costs. And why I'm examining this with you is it's one of the fastest growing costs in our country and has been. We have to do something about it. We are slowly probably moving more towards just a, one plan for all under the federal government, but it's not there. So this is why it's so important for you guys to understand this, because you want to be able to buy the right plan and spend the least amount of money if you can, right? So the average annual worker and employer premium contributions for family coverage, you're going to see from 2011 to 2021 today. So if we look at 2011, you were paying $4,129 for family coverage, and the employer was paying $15,000. Again, the example that the employer is paying the majority of the premium. It's great. You move from 2011 to 2016, there was a total increase of 20% premium increase. So does your bread go up that much? That, does your cost of your electricity, you look at these things and realize this is, one of the fastest escalating costs in America, healthcare. So now we go from 2016 to 2021, and it's escalating at 22% for a similar time frame. So now employers are paying $16,253, and you're up to $5,969, which erodes your income, your take-home income. So that's why the importance of paying attention to what's available in the marketplace, have a voice, if you can, in what we do in our state to provide affordable healthcare. And always, when you're looking as an employee, a valuable employee, ask about their medical plan and what your outlay of premium is going to be. Okay, because that's going to be a big part of who you want to choose as your employer.
Yeah,
I'm sounding like a parent for sure right now, but actually, it's just experience and wisdom, and knowing that it's really more important than ever to find health insurance that's affordable and you pay less out of your pocket. So I'm bringing up my PowerPoint one more time, and we're going to close here with a couple of items that I think might be valuable. You guys can access this on your own, but when I look at an employer and I help them design it, here's some things to think about. What you guys want in ages 17 to 32, right, is very different in my age bracket, over 50. You guys typically want protection for medical and dental expenses. You want fun and affordable health, and you want wellness services. You want to do, outdoor activities and have the employer help pay for those so that you're healthy. And you want education. To be fulfilled, you want a work life that fits. Positive reinforcement, new challenges, flexibility now, in your schedule and where you work. Relevance. It's really important to have immediate feedback, open, constant communication. And so there's a lot of things that go into how do you pick your best employer. So I just offer this to you to look at in terms of what we know. This is through a MetLife study. They're an insurance carrier of feedback based upon your demographic profile. And again, if you're, 33 to 47, some of those things are going to change, right? Some of those things, you're going to be a little bit more conservative in your choices on your health insurance because you probably have children or you're in the birthing ages. So you're probably going to want more upfront coverage. Office visit copays are going to be important because if you have sick kids, often you're in there more often than when they're older, just because they get the bugs, more often, or they're in daycare. So think about these things, look at these. It's kind of interesting, actually. I think when you think about what's important to you, your priorities, what makes you secure, what makes you fulfilled, and what's relevant. Dental always has a deductible as well. They're lower. It usually has a co-insurance, a co-insurance, yes. Preventive services are paid at 100%. You'll see here. If you go for basic services, cavities, some of your fillings, sometimes, the gum work or just restorative things that are happening could be covered under basic. So you're going to pay the deductible and then the plan pays 80%. Most of your dental plans have a annual maximum. This one is $2,000. But examine your dental plans. Dental care is extremely important. You always want to get your preventive exam every year. I will share with you, I've got great staff and some folks just never had really good dental care growing up. Their biggest expense is dental care every year because they're already 30 years old and doing implants. So going and having your preventive care services now is invaluable. Again, it's a capped amount you get under dental care of $2,000. So if you have dental issues, you can always use a health savings account to pay for those expenses. Often, just let me comment on employers often will pay for the single premium, not always family and child coverage. So just look for an employer who's going to help you fund your medical, dental, vision coverage. Vision's important, right? Glasses, eye exams, whether you need any lenses, contact lenses or frames, just those annual exams are important. They can find things that are related to your health. Good example is high blood pressure. So I have several friends who are physicians and that have identified high blood pressure in an individual just through their eye exams. So untreated high blood pressure can create obviously significant cardiovascular issues that can change, your lifestyle, even cause death. So vision exams are just as important. Often you'll have a $10 copay for the exam or none, and it'll be paid at 100%. So make sure you pay attention to those vision plans, and I would highly enroll and encourage you. Low cost, high value. You're never going to know, but disability insurance is critical, especially in the short term. If you have an injury, you're out skiing. I decided to play soccer at 47 and had a tibial plateau fracture. I was out of work for 6 weeks. Okay. I was able to work from home a little bit on my computer, but I lost income. So I had a short-term disability plan that essentially paid 60% of my income up to a certain amount per week. Without that, I would have been without income. So I always look to my employer to say, do you have disability coverage? For many of you, the short term is going to be really important. Few need it for the long term. But if you have cancer, cardiovascular issues, or musculoskeletal issues, leading causes of a longer term disability, these are critical for you to be able to continue to have income even though you're not working. So this replaces your income if you're not able to do the work that you're doing today. So I look for those. Long-term care, be aware, this is probably for many of you something you may or may not be aware of. It's insurance that you can purchase that protects your assets. And it really is a version of paying you a benefit for care in the home, care in assisted living, or care in a nursing home. Most often it's for when you're older and you can't perform 2 activities of daily living. So they're called 280Ls. It's whether you're bathing, dressing, toileting, transferring from room to room. If you're not able to do 2 out of 6 of those, this benefit would begin to pay. And the chart here just shows you the needs for those types of services as you age. Buying it young means that you buy it at a lower rate and it stays at that rate. My husband and I bought it at 40. I think he thought I was part-time crazy, but our rates have stayed at that level. And when we need that care, we don't need to use our retirement savings to pay for that care. It can exponentially be extremely expensive. So long-term care protects your assets and provides benefits if you need care in the home or in a facility. That is a lot. I hope I've been helpful for all of you. I hope there's been some pieces that you can take away that really provide you information you need to make good decisions. And when you are confused, health insurance is confusing, find a great advisor is my best advice, and lean into them and let them help you through these challenges of making good decisions for you and your family.
Thanks, Becky.
Mm-hmm.
Gosh, yeah, that was completely fluid speaking for 75 minutes and kind of scratched the surface. I'm sure for a lot of you, you feel a little overwhelmed if you've never looked at any of these topics before. It is so much information. But I think just to reiterate Becky's takeaways is if you're looking at the exchange on your own because you're between school and an employer or you're starting your own business, get an advisor. If you're going to work or you're considering different employment offers, make sure that you get the plans and you analyze them. And again, if that feels like beyond your capacity to really understand how to compare different employers or plans within one employer, again, get a consultant, because these, lots of times the compensation package
Mhm.
looks more attractive, but the insurance might not be nearly as well, and based upon your
Right.
needs or your family. Most of us, as when we're young, we go straight for the money, but that may not be the best choice. So yeah, thank you very, very much, Becky. And I'm gonna give you a call. So I'm gonna email you and get your direct number, and then I just want to have a quick chat, okay?
Sounds good. Thanks, everyone. Happy holidays, and hope you do well in life.
Thanks so much, Becky. Talk to you soon.
Bye.
Bye.